Hi, I'm Louis Blank at the Centers for Medicare and Medicaid Services. As a healthcare professional, you document your patient's important medical information every day. But have you ever stopped to think about how this documentation fits into patient care and claims payment? Documentation is the vehicle that communicates who, what, when, why, and how to other patient caregivers. Proper documentation is important for a number of reasons. First, it helps promote quality patient care. It also ensures patients get reasonable and necessary items and services. Next, proper documentation supports proper claims payment. When you completely and accurately document the items and services you provide, we can process your claims correctly the first time. Proper documentation also helps support favorable medical review decisions. This reduces the administrative costs associated with appeals. Even though we know that proper documentation is important, the Comprehensive Error Rate Testing, or CERT program, continually finds these four errors: insufficient documentation, medical necessity, incorrect coding, and no documentation. The leading cause of claims errors is insufficient documentation. But what does that mean? Insufficient documentation means that something was incomplete or missing from the documentation a provider submitted with the claim. Now that we've discussed the benefits of proper documentation and we better understand what insufficient documentation is, let's take a look at what happens when you don't provide the proper documentation. When we deny your claims, your practice or facility loses revenue. Take a moment to consider the cost to your practice or facility because of claims denials. If you appeal a claim denial or must resubmit a claim, you'll take additional steps, like completing forms, submitting extra documentation, and sending letters about why you believe we should pay a claim. These steps take time and cost money. Proper documentation is a sound way to protect the financial health and sustainability of your facility or practice and your medical peers. Ensuring your documentation reflects the medical necessity of the items or services you provide, and correctly coding your claims will reduce denials and overpayments. Even more importantly, proper documentation is critical to proper and comprehensive patient care. Think of it this way. If an order is illegible, a patient could get the wrong medication, test, item, or service, which could put a patient's health and safety at serious risk. Patient care errors and financial consequences can significantly impact your facility or practice. This is why it's important to respond to documentation requests from a CERT program, clinics, facilities, laboratories, durable medical equipment suppliers, and other physicians. In some cases, the CERT program may request a review. If this happens, you must provide supporting documentation. Here are some tips to help you if you need to respond to the CERT program's request for records. First, make sure you provide all records that support payment. Keep in mind, this may include records for services before the date of service listed on medical record request. What if you're not sure if you should include a document? Go ahead and include it anyway. It might be the key document or information that supports the item or service you provided. Next, make sure you send the documentation by the deadline in the request. The last step is to review your documentation. A good way to double-check is to make sure the information in your documentation answers the questions who, what, when, why, and how. Even the most comprehensive documentation must not only verify that you performed each item or service for which you billed, but must also verify the medical necessity for each and every item or service. Your Medicare Administrative Contractor, or MAC, can help you understand the documentation requirements, including signature requirements. You can visit your MAC's website. There are several other resources available to give you more information. To learn more about Medicare's documentation requirements, review the Medicare Learning Network, or MLN fact sheet, called Complying with Medical Record Documentation Requirements. And for more information on Medicare signature requirements, review the MLN fact sheet called Complying with Medicare Signature Requirements. Finally, you can visit the CERT AB MAC Outreach and Education page on cms.gov.
This educational product was prepared as a service to the public and is not intended to grant rights or impose obligations. This educational product may contain references or links to statutes, regulations, or other policy materials. The information provided is only intended to be a general summary. It is not intended to take the place of either the written law or regulations. We encourage readers to review the specific statutes, regulations, and other interpretive materials for a full and accurate statement of their contents. The Medicare Learning Network, MLN Connects, and MLN Matters are registered trademarks of the U.S. Department of Health and Human Services, HHS, paid for by the Department of Health and Human Services.